Blackheads are one of the most common and persistent skin concerns, and they can be especially frustrating because they often come back even when you feel like you are doing all the right things. The good news is that blackhead prevention is usually very achievable when you understand what a blackhead actually is, what makes pores clog, and how to build a routine you can maintain comfortably for the long term. This guide is for general education and skincare support and is not a personal medical diagnosis. Skin is highly individual, and if you have severe acne, painful deep bumps, frequent infections, significant scarring, eczema, rosacea, or if you are pregnant or nursing, it is safest to speak with a qualified clinician before starting strong active ingredients. With that said, most people can reduce blackheads significantly by focusing on 3 priorities: keeping pore traffic flowing, supporting the skin barrier, and avoiding the common behaviors that repeatedly inflame and refill pores. To prevent blackheads, it helps to understand how they form. A pore is the opening of a hair follicle, and attached to that follicle is an oil gland. Oil production is normal and beneficial. It helps protect the barrier, reduces water loss, and keeps skin flexible. A blackhead forms when oil mixes with dead skin cells and that mixture becomes trapped inside the follicle. Because the pore opening remains open to the air, the top portion of the plug oxidizes and turns dark. That dark color is not dirt and it is not proof of poor hygiene. This is one of the most important mindset shifts for prevention. Blackheads are a pore mechanics issue, not a cleanliness issue. When people treat blackheads as dirt, they often scrub too hard, wash too often, use harsh cleansers, and squeeze aggressively. Unfortunately, those behaviors can inflame the follicle lining, make the pore opening swell, disrupt the barrier, and actually create conditions that make clogs form faster and refill more stubbornly. Another key concept is the difference between true blackheads and sebaceous filaments. Sebaceous filaments are normal structures within pores that help transport oil to the surface. They often appear as small, uniform gray or tan dots, especially on the nose, and they refill quickly even with excellent skincare. True blackheads are typically darker, more distinct, and more irregular in distribution. Why does this matter? Because many people attempt to eliminate every dot on the nose, which is often unrealistic and leads to overtreatment. A better goal is smoother texture, fewer true blackheads, and less noticeable congestion overall. When you aim for healthy function rather than perfection, you can follow a routine that keeps your skin calm and your results more stable. Now let's build the prevention plan from the ground up. The foundation is cleansing correctly, because prevention fails when cleansing is either too weak, leaving behind residue that contributes to clogs, or too harsh, stripping and inflaming the barrier. A good cleanser should remove sweat, excess oil, and daily residue without leaving your skin squeaky, tight, or stinging. Tightness after cleansing is not a sign of deep cleanliness, it is a sign that you have removed too much of the barrier's protective lipids. When the barrier is stressed, skin can become more reactive and inflamed, and shedding becomes less orderly, which can worsen congestion. For many people, cleansing twice daily is fine, but it should be adapted to your skin. If you wake up oily or sweaty, a gentle morning cleanse can help. If you wake up dry, tight, or sensitive, rinsing with water in the morning and cleansing only at night may be better. The most important cleanse of the day is almost always the nighttime cleanse, because that is when you remove sunscreen, makeup, and environmental buildup that can sit on the skin and contribute to clogged pores. Nighttime removal of sunscreen deserves special attention because it is a frequent hidden reason blackheads persist. Sunscreen is essential for overall skin health and for preventing post-acne marks, and it is especially important if you use exfoliants or retinoids. However, sunscreens are designed to adhere to the skin, and many formulas are water-resistant or long-wearing. If you do a quick wash and leave behind a thin film, that film can mix with oil and dead skin cells inside pores over time. People may assume sunscreen causes blackheads when the real issue is incomplete removal. A practical solution is using a gentle first step to dissolve sunscreen and makeup, followed by a gentle water-based cleanser to rinse everything away. This can be micellar water, a cleansing oil, or a cleansing balm, followed by your regular cleanser. This approach does not have to be harsh, and it does not require aggressive scrubbing. Gentle massage for adequate time, then thorough rinsing, is often enough. Your skin should feel clean and comfortable afterward, not stripped. After cleansing, the next pillar of prevention is normalizing how the pore lining sheds. Blackheads form when dead skin cells do not shed evenly and instead cling together, mix with oil, and form a plug. Two ingredient families are particularly effective for preventing this: salicylic acid, a beta-hydroxy acid, often called BHA, and retinoids. Salicylic acid is oil-soluble, which helps it move into the oily environment of the pore lining and loosen the mixture of oil and dead cells. Retinoids help regulate cell turnover and reduce the tendency of cells to clump inside follicles, preventing microclogs from forming in the first place. Both can be effective, and the best choice is often the one you can use consistently without irritation, because consistency is what changes pore behavior over time. Salicylic acid is often an excellent first-line option for blackhead-prone skin. It can be used in a cleanser or as a leave-on product. For prevention, the goal is steady, tolerable use, not burning or peeling. Many people do well with a leave-on salicylic acid product used 2 to 3 nights per week at first, then gradually increased if the skin stays comfortable. Others prefer a salicylic acid cleanser a few times per week, which may be gentler because it rinses off and has shorter contact time. The most common mistake with salicylic acid is doing too much too soon, then experiencing dryness or stinging and stopping entirely. That stop-and-start pattern prevents the pore lining from stabilizing. If your skin becomes persistently red, burns, or peels in sheets, reduce frequency and focus on moisturization until your barrier calms, because irritated skin often clogs more easily. Retinoids are another powerful prevention tool, especially for long-term improvements in texture and congestion. Over-the-counter options include retinol and retinaldehyde, and in some places adapalene is available without prescription, while stronger retinoids require a prescription. Regardless of type, the technique matters. Use a small amount, apply to dry skin, and increase frequency slowly. A pea-sized amount for the entire face is typically enough. Applying more often causes irritation rather than faster results. A good approach is 2 nights per week for a couple of weeks, then every other night if tolerated. If your skin stays comfortable, you can consider increasing. If you become dry or irritated, buffering is a helpful strategy. Apply moisturizer first, then retinoid, then another thin layer of moisturizer. This can reduce irritation and help you stay consistent. Retinoids often take 8 to 12 weeks to show noticeable improvements, and results can continue to improve over months. If you are pregnant, trying to conceive, or nursing, do not start a retinoid without medical guidance, because topical retinoids are generally avoided during pregnancy and individualized advice matters. Do you need both salicylic acid and a retinoid? Not necessarily. Many people do best with one primary active and a gentle supportive routine. If you do combine them, a safer approach is alternating nights rather than layering them together, especially when building tolerance. Layering multiple strong actives can increase irritation, and irritation can worsen congestion. It is perfectly appropriate to have rest nights where you use only moisturizer and barrier support. Those rest nights are not wasted. They can be the difference between staying consistent for months versus quitting after 2 weeks because your skin feels raw. Now let's talk about the skin barrier, because barrier health is the quiet factor that makes prevention sustainable. Your barrier is the outer protective layer that keeps water in and irritants out. When it is damaged or inflamed, skin can become more reactive, and the shedding process becomes less orderly. That can contribute to blackheads. This is why moisturization matters even if you have oily skin. Many people with oily or blackhead-prone skin skip moisturizer because they fear it will clog pores. In reality, the right moisturizer can improve tolerance to actives, reduce irritation, and help pores shed more normally. Choose a lightweight moisturizer that feels comfortable and does not leave you greasy. Ingredients like glycerin, ceramides, panthenol, and sometimes niacinamide can support barrier function and hydration. Niacinamide can be helpful for some people in regulating oil and improving texture, but it can irritate a subset of people, especially at high percentages. If a product causes stinging or flushing, choose a simpler moisturizer. The best moisturizer is the one you can apply daily without discomfort. Sunscreen is a major part of prevention for 2 reasons. First, UV exposure can contribute to thickening of the outer layer of skin over time, which can worsen uneven shedding and congestion. Second, UV can increase inflammation and worsen post-acne marks, making the skin appear more uneven. If you use exfoliants or retinoids, sunscreen becomes even more important because your skin may be more sun-sensitive. If you feel that sunscreen causes congestion, first check two things: whether the texture is too heavy for your skin and whether you are removing it thoroughly at night. Many blackhead-prone people do well with lightweight fluid or gel sunscreens. The goal is consistent sunscreen use with a removal method that prevents residue buildup. Avoiding sunscreen often makes long-term texture and marks worse, even if it feels temporarily less greasy. Now we need to address the behaviors that sabotage prevention. The first is aggressive physical scrubbing. Scrubs can create microirritation and disrupt the barrier, which can make pores look larger and more noticeable and can increase clogging. If you are using salicylic acid or a retinoid, you usually do not need a physical scrub. The second is frequent pore strip use. Pore strips can remove surface material, but they often remove sebaceous filaments that naturally refill, and they can irritate the pore opening. Irritated pores often refill faster and appear more visible. The third is frequent squeezing and picking. When you squeeze, you can rupture the follicle wall, trigger inflammation, and increase the risk of dark marks and scarring. If you feel compelled to extract, do so rarely and gently, with clean hands after a warm shower when the skin is softened, and stop immediately if the plug does not release easily. Never dig with sharp tools. Never continue until the skin breaks. If congestion is widespread or stubborn, professional extraction by a trained provider is safer and often more effective than repeated at-home trauma. Hidden triggers matter, and many people overlook them. Hair products are a common one. Pomades, oils, thick conditioners, leave-in products, and styling creams can migrate onto the forehead, temples, and cheeks and clog pores, especially along the hairline. If your blackheads cluster near the hairline, consider keeping heavy hair products away from the scalp line, rinsing conditioner thoroughly, and washing your face after styling if product touches skin. Nighttime contact also matters. Hair coated with product can rub against cheeks during sleep and contribute to congestion. Small changes like clipping hair back or switching to lighter hair products can make a noticeable difference. Sweat and friction are another common trigger, particularly under masks, helmets, straps, or tight clothing. Heat, humidity, and friction can swell the pore opening and trap sweat and oil. This is sometimes called acne mechanica. The solution is not harsher cleansing or scrubbing. The solution is gentle cleansing after sweating when possible, avoiding heavy occlusive products in friction zones, and maintaining your prevention routine without overdoing it. If you cannot cleanse immediately after exercise, even rinsing with water and gently patting dry can help reduce the buildup that leads to clogs. Makeup can be compatible with blackhead-prone skin, but removal and tool hygiene matter. Heavy foundation layers and frequent touch-ups can contribute to congestion if removal is incomplete. Brushes and sponges hold oil and residue. Cleaning them regularly can reduce the chance of pore clogging buildup. If you suspect a particular makeup product is contributing to blackheads, simplify your routine for a few weeks and reintroduce products one at a time to identify triggers. Texture choice is another underrated prevention tool. Many people have combination skin, an oilier T-zone and drier cheeks. If you apply rich, occlusive creams heavily on the T-zone, you may trap oil and worsen congestion. A practical approach is zone-based skincare, lighter textures on the nose, chin, and inner cheeks, and richer moisturization only where you are truly dry. If you like facial oils, use them sparingly and consider mixing 1 or 2 drops into moisturizer rather than applying oil directly to areas where you clog most. Now let's put this into a simple daily routine that you can maintain. In the morning, cleanse gently if needed. If you wake up oily or sweaty, use a gentle cleanser. If your skin is comfortable or dry, rinse with water. Apply a lightweight moisturizer if your skin needs it or if you use actives at night. Then apply sunscreen. In the evening, remove sunscreen and makeup thoroughly, cleanse gently, pat the skin dry, apply your chosen active on dry skin, then moisturize. This may sound basic, but basic is powerful because it is repeatable. The routines that work long-term are the routines people can maintain without burning, peeling, and frustration. How long should you expect prevention to take? Blackheads do not typically disappear overnight. You are working with the life cycle of the follicle and the shedding process inside the pore. With consistent salicylic acid use, many people notice smoother texture within a few weeks, but meaningful reduction often takes 8 to 12 weeks. With retinoids, improvements often become noticeable around 12 weeks and can continue improving for months. The most common reason prevention fails is not that ingredients do not work, it is that people change routines too quickly or stop because of irritation. Choose a plan, introduce it gradually, and give it enough time to work. You may also hear about purging, especially with retinoids. Retinoids can cause a temporary flare as microclogs come to the surface. True purging typically occurs in areas where you already clog and gradually improves over several weeks. However, many people mistake irritation for purging. Irritation looks like burning, persistent redness, itching, rash-like bumps, or breakouts in new areas you do not normally break out. If you suspect irritation, pause the active, simplify to gentle cleansing and moisturizing, and restart later at a lower frequency if appropriate. There is no benefit to pushing through severe irritation. Irritation can worsen acne and increase post-inflammatory marks. If your skin is sensitive, prevention is still possible, but tolerance becomes the priority. Start with barrier basics for a couple of weeks: gentle cleanser, moisturizer, and sunscreen. Then introduce one active at low frequency. Consider a salicylic acid cleanser a few times per week or a low-strength retinol, and use buffering techniques. Keep the routine simple. Sensitive skin improves when it stays calm. If your skin is very oily, the prevention strategy still relies on balance rather than stripping. Avoid harsh cleansers that leave skin tight, because overwashing can trigger reactive oiliness and irritation. Use a gentle cleanser consistently, consider salicylic acid as a main active if tolerated, and do not skip moisturizer. A lightweight moisturizer can